The following segment is sponsored by Center for Sports Medicine.
And we've got Dr. Jason Robertson joining us today. He's with the Center for Sports Medicine and Orthopaedics. Hello, Dr. Robertson. How are you?
Hey, James. Doing well. Hanging in there.
Good. I take it, I don't ask all the doctors this, but are you at your office or are you at your office at your home?
No. I'm at the office. It wouldn't be this quiet at my house.
No, he has 5 kids. I bet it's nice to get away from the kids every once in a while. On that note, because I want to talk to you about staying active during this time of change, but doctors have experienced a lot of change lately. And when it comes to physical therapy and when it comes to meeting your patients, what does that look like for you personally?
Well, some of the visits are normal where, it's injuries and people are still out and about getting injured and people are still trying to get active and stay active. And so you'll still have an ankle sprain or a fall and a wrist fracture. So we're still seeing those patients. And that's why we're here for the orthopedic walk-in clinic or urgent cares for those issues. Now, it has changed in some respects because we're doing a lot more telemedicine where we're trying to encourage our older population or those who have comorbidities to stay home, and we can do a lot of these visits via video conferencing and phone calls. And so that has changed quite a bit. And of course, the volumes are down because people are doing what they're supposed to do to protect one another by staying inside and sequestering and kind of quarantining themselves.
And I guess those numbers are down because, a lot of folks are not doing sports right now.
That's right. So, of course, all the high school sports are canceled right now, which is sad, and that's keeping people from getting injured. And then the younger population with academy sports and travel sports are not busy right now. And then, of course, people just are staying inside a lot more, so that's keeping people from being injured.
Sure. And you touched on this a few moments ago, but the walk-in clinic is still available?
Right. That's right. So that's been, we've been open during that whole time just to be available for patients to offload some of our colleagues at the emergency room who are, so ably and bravely kind of serving right now to be available for those injuries that don't need emergent care, but are here for x-rays and further imaging and those kinds of things.
When it comes to staying active during this time of change, what are your recommendations?
Well, you still have recommendations to try to get, 150 minutes of exercise a week of cardiovascular exercise. And it's harder to do that now, probably more than ever, but there's still ways to do that, in the house with body weight, with, cans of soup, with Coca-Colas, those kind of things can serve as weights and you can still use your body weight, jogging in place, doing up downs, jumping jacks, jump rope. If you have an exercise bike or a stationary recumbent bike or even a road bike, a rowing machine, any of those things are great and healthy just to get out and about and get that heart rate up. So we still want people to be active and do those things to help cardiovascular prevention. And also it's good for mental health right now. And that moderate dose of exercise will help boost your immune system, which we all could need right now, too.
Yeah, I was on the show just a couple of weeks ago with a fantastic Hamilton County PE teacher. We were working out with toilet paper.
Right.
So you can pretty much work out with just about anything under your roof. Center for Sports Medicine and Orthopedics. Here is the Chattanooga number, 423-624-2696. Outside of Chattanooga, 1-800-757-2696. sportmed.com.